Pennsylvania Substance Use Navigation Program, or PA-SUN. This is a brief video on how to become a buprenorphine waivered practitioner. As of April 28, 2021, any DEA licensed provider can apply for an X waiver without completing additional training. So this includes physicians, nurse practitioners, physician assistants, clinical nurse specialists, certified registered nurse anesthetists, and certified nurse midwives. What you're going to do is apply under the practice guideline exemption, and you'll be limited to no more than 30 patients at one time. Some people worry that they may exceed this. We have emergency physicians who are also boarded in both medical toxicology and addiction medicine who prescribe buprenorphine multiple times per day and have never run into this issue, so not to worry. What you need to do is submit a notice of intent, or NOI. And to do that, you go on the NOI website, which is part of the DEA website. And you will select certification of qualifying criteria and then to enter practice guidelines in the text box. You'll see a page like this, which reminds you that you'll need your DEA number and your state medical license number. You will then select the type of practitioner you are, your licensing state, enter your state medical license number and your DEA registration number. You will ignore this pop-up, which is really for people who are applying to take care of 100 patients on buprenorphine at a time. Those are for folks who are certified, board certified in addiction medicine. And you will note here that you will select no to being a board certified addiction medicine physician, unless that applies to you, and no to the question about providing medication assisted treatment under CFR 8.2. That is for licensed drug and alcohol clinicians. Instead, you will select that you wish to apply for the 30 patient level with exemption, meaning no training required. You will then enter your information, your name, your medical license number and state, your address. Use the address that is on your DEA certificate. And then you will be asked if this practice location is an FQHC, or federally qualified health center. You should select no, unless that specifically applies to you. Those are typically outpatient clinics. You will indicate that the purpose of this notification is a new notification to treat up to 30 patients. You will then select that when providing maintenance or detox treatment with buprenorphine, that you will use only scheduled drugs, so FDA approved drugs. Buprenorphine is a Schedule III drug. You will then select that you are doing this under the practice guideline exemption. You will then certify that you have capacity. In other words, you are an individual who can indeed prescribe, and that you have a maximum load of 30 patients at any given time on buprenorphine. When asked if you want to consent to release your name and information on the SAMHSA treatment locator website, that's for patients looking for buprenorphine prescribers, I suggest stating that you do not consent to this. And further, that you do not want to be identified on the website as providing treatment with any of these long-acting agents. You then certify that the information is accurate. You re-enter your DEA number, and then you hit submit, and you should receive your X waiver number within 45 days. And then you'll be ready to prescribe buprenorphine. There are a number of resources on the SAMHSA website, including frequently asked questions about buprenorphine and practice guidelines, and then some practitioner resources. And then we at PA-SUN would like to offer you resources, particularly to your emergency departments. It is now standard of care to provide buprenorphine as part of emergency care provided out of emergency departments, and that we are a statewide initiative offering emergency departments the opportunity to receive free technical assistance, consultation, and support from expert opioid medical consultant clinicians to optimize care for patients who present to your emergency department with opioid use disorder. So if you are interested, please reach out to PA-SUN. We'll ask that you do a needs assessment, and then we will work with you to provide support and resources. Thanks so much for listening, and appreciate you considering applying for your X waiver.